We turn now to the coronavirus and a new headline that is getting a lot of attention. A new analysis by the Kaiser Family Foundation shows 58% of COVID deaths in August were people who have, at one point, received a vaccine. To tell us what's going on here, we're joined by CBS News Contributor Dr. Céline Gounder, who is also Editor-at-Large for Public Health at Kaiser Health News. Doctor, good morning. Good to see you.
Good to see you.
So let's go through this headline. Only 13% of Americans age 18 and older have gotten an updated booster. So will the boosters protect against the current variants of the COVID-19 infection that is going around now? And if someone gets that booster, more importantly, will they be protected in time for year-end gatherings?
What we know is that getting an updated booster is better than not getting a booster. So it may not be perfect, it may not be perfectly matched against the currently circulating variants, but it is better than nothing. And if you are somebody who is 50 and over, if you're immunocompromised, if you're pregnant, it is especially important that you go out and you get a booster dose.
But help me understand this headline, because I've seen it trending on social media that people who have received a vaccine, but not necessarily a booster, are now succumbing to the virus. What does that mean?
Well, this is something we've been trying to message since the beginning of vaccine rollout, that eventually, when enough of the population is vaccinated, this is to be expected because so many people are vaccinated. You're going to have some breakthroughs, some hospitalizations and deaths in that group. But I think the clear message to give people is currently today, if you have been vaccinated and you've gotten your updated booster, you are 15 times less likely to die than somebody who is not vaccinated.
So a booster means you're up to date. So the vaccine, if you just have the initial vaccine, then it no longer is steady in keeping you
protected. Yeah. And especially, again, if you're over 50, if you're immunocompromised, if you're pregnant, your immune system just doesn't respond as well to the vaccine. And so especially for those groups, because you're at higher risk for progression to severe disease, you really need to go out and get that booster as soon as possible. And it does take about 2 weeks for that booster to really kick in, so take that into account as well.
And it's a reminder, too, that we could all use these reminders of basic things we've learned during the pandemic that folks just aren't really up to speed on. What about those? There's some folks watching right now who have COVID. They may want to see relatives tomorrow or next week or at some point. What's the advice for recovery time? And is there really anything you can do to speed that up before you can see people?
Well, there are medications, and I think this is something that people are forgetting. There are medications, an oral pill that you can be taking for COVID. It's been a little challenging, I think, for some people to access that. Part of that is doctors, unfortunately, don't understand it's not how sick you are now. That's not what determines whether you should get treated with Paxlovid in particular, but rather, are you at increased risk for progression to severe disease? So again, people over 50, people who are immunocompromised, people who have underlying medical conditions. Those are the people, if you have COVID, you should get started on treatment right away. And one avenue that's opened up that will make it much easier to get this is CVS now has their pharmacists prescribing Paxlovid. So you can go online to CVS, to their website, follow the instructions, and you can get Paxlovid that way.
Wow. Good to know.
Good
All right.
to know.
Dr. Céline Gounder, great to see you. Happy day after Thanksgiving as well.